New at 10. Tonight, we have more information on coronavirus antibody testing and whether or not you can tell if you had the virus in the past. Earlier today, the CDC warned that results from these types of tests can be wrong up to 50% of the time. We took this information to the Alabama Department of Public Health, where officials say the antibody test definitely has its flaws. In a statement, Dr. Karen Landers says, quote, since ADPH remains concerned about the application of antibody testing in determining an immunity for COVID-19, ADPH cannot recommend antibody testing as an indicator of protection from the disease. Way 31's Stephen Delcizian has been following this all day and joins us now with the latest. Stephen.
Yeah, Dan, I'm here just outside of Huntsville Hospital where they offer antibody testing to patients as long as a physician signs off on it. The Huntsville Hospital CEO David Spillers says they use a specific test that they believe is more accurate and precise than many others.
And a physician wants to order antibody testing, we can do that and get the results back fairly quickly. Since it's all run in-house, generally it's the same day result back to the physician office.
Antibody tests determine if you've been exposed to the coronavirus or have some type of immunity to it. Spillers expects most of the results from antibody tests to come back negative.
Most of those will come back that people don't have antibodies. Just statistically speaking, that's just where the numbers are going to be.
Spillers provided Way 31 with data showcasing the effectiveness of the antibody tests they use. The test will determine a correct negative result 99.8% of the time. However, the test becomes less accurate when determining a positive result, with a 65% effectiveness within 6 days of a positive coronavirus case. He says there's a high demand for these tests.
I think there's been a curiosity about that for a long period of time, until we had a test that was reliable and until we had a methodology where there was a process to get that test, where there was a discussion with the physician. We weren't going to make it available, so we did make it available because of consumer demand.
Right now, it's unknown how long antibodies last after an infection. Spillers also says if you have the antibodies, you could still be at risk.
It doesn't mean you're Superman or Superwoman and you're immune and you can go do all these things. You could be COVID positive when you have the antibody test. There's a variety of factors.
Now, the CDC says because many antibody tests could be misleading, they recommend that no guidelines or policies be made based on the data. I asked the Alabama Department of Public Health if they've done that. They said they've never used antibody testing data to make a guideline or a policy. Reporting live on Governor's Drive, Stephen Delcizian, Way 31 News.